we ready? Should we get going? All right, so welcome everyone. This is our third session of Fair Housing Friday. So we've already done two. You might have joined us last week for tenants' rights during COVID-19, and our original one was state and federal policy. And those recordings are or will be on our website by the end of the day, I can assure you, because I am in control of that. So yeah, welcome to Fair Housing Friday. This is part of a series for Fair Housing Month. April is Fair Housing Month, and we had to transition to this online format for obvious reasons, but we are really excited about the kind of engagement we've had through these webinars, lots of questions that we're eager to answer. And we do have a Q&A that will be happening about partway through the session. So if you could just keep your microphones muted for the meantime, we'll let you know when that Q&A session is being opened up. And thank you so much for joining us. And as I said, we do have 60 people signed up, lots of people probably jumping on the call late. So just being, you know, I think we're all getting used to this webinar format and learning about the different ways we can interact with this technology. So just be aware, keep your microphones muted, and save those questions for the end. And as always, we do try our best to answer your questions, but policy is changing really fast in this moment. So if we don't have the answer right now, we'll do our best to make sure that we get that to you in our follow-up. We send a follow-up email with our recording and the resources that we referenced throughout the webinar. Let's see. Oh, please note that we are recording. So just keep aware that that's part of the webinar. It's really important for us to make this accessible to people at the end. Yeah, before we get started, I think Jess is just going to give us a little information about the Fair Housing Project, and we apologize for those who have been with us for the past two. There might be some repeat information, but you know, really important part of the webinar. Jess, there you go. Take it away.
Great. Thank you, Corinne. So fair housing is really of particular importance now. You know, as the COVID-19 pandemic, and especially as the pandemic subsides, you know, the crisis has really, it's turned our world upside down. And it's really illuminated these really deep disparities and deep inequalities in our economic system, our health system, and in housing too. Because we all know that where we live has an incredible impact on our lives and our opportunities. And so when entire groups of people can't access safe, fair, and affordable housing, it has a long-term effect on our communities. And the housing implications of this crisis really, they're going to be long-lasting. And choice in housing is important, and access to housing is important. So what is fair housing? So fair housing is the right to equal opportunity in housing choice and the right to rent or buy a dwelling free from discrimination. And so the Fair Housing Act, which was passed in 1968, established essential protections in federal law, making it illegal to discriminate based on race, color, national origin, religion, sex, family status, or disability. And states have the opportunity to add additional protections. Here in Vermont, we have additional protections based on age, marital status, sexual orientation, gender identity, receipt of public assistance, denial of development permitting based on income of prospective residents, and most recently, just passed last year, victims of abuse, sexual assault, and stalking. And so here in Vermont, there are a number of organizations working to promote and expand fair housing rights. So the Fair Housing Project is one of CVOEO's 3 statewide housing programs, together with Vermont Tenants and the Mobile Home program. And we work to protect and expand that fair housing rights for everyone who experiences discrimination and inclusion. And as part of this mission, we also coordinate Thriving Communities, which is a statewide collaboration that raises awareness about the economic and social benefits of affordable inclusive housing. And so our work is focused on education outreach, and we work closely with Vermont Legal Aid and the Human Rights Commission. And both of those organizations do enforcement and testing, and you'll learn more about the Human Rights Commission in just a few minutes. So we have some really special guests today. We have Ted Wimpey, who is the former director of the Fair Housing Project at CVOEO and an incredible advocate for affordable and fair housing rights. And we also have Melissa Horwitz with the Human Rights Commission. So we're really honored to have both of you here today and can't wait to start the conversation. Without further ado, we'll turn it over to our guests, who will be talking about housing discrimination in Vermont and around the country, the connections between housing policy and access to housing, and then other fair housing issues. So thank you.
And I think just, Melissa, I think it would be best to go ahead and start with you. If you could just tell our viewers a little bit about the Human Rights Commission and what you do.
Absolutely, that'd be my pleasure. Thanks so much for having me as part of this. This is a great group, and I'm really glad these discussions are being had, really important at this time. So the Human Rights Commission is a state agency. We're a little bit of a weird state agency because we actually do sue the state, but we are still a state agency, and our mission is to promote full civil and human rights in Vermont. We pursue this mission by enforcing the laws through investigations into discrimination. That's probably what we're most known for. We also do education to the public. We try and provide information and referrals to people that may not fit under what we do within our jurisdiction, but there's other agencies and groups that could help them. So we play that role. And we advance human rights public policies. So just make sure, that the information we have and that we're learning through our daily work is getting back to, legislators and different policymakers that can make the change that needs to be done. Our structural organization is that we have 5 human rights commissioners, and those are appointed by the governor, and they have 5-year staggered terms. So they meet monthly. We usually have a monthly commission meeting where any cases that have not been resolved will go before the commissioners for them to make a decision on whether they think there's reasonable grounds that discrimination occurred or did not occur. They also set, our policy goals and things like that. In terms of staff, we have 6 individuals now on our staff, which we're thrilled about. Just added a new education and outreach person who does legislative work as well. And then we have our executive director, who obviously does everything. And 3 staff attorney investigators. So I'm one of those. An executive staff assistant, case manager, and then our education and outreach coordinator. So what the commission can do, we hope to protect people from unlawful discrimination in the areas of housing, state government, employment, and public accommodations. And just in case people don't know, public accommodations include schools, restaurants, stores, just places that offer goods or services to the public. So it's basically everything that's shut down right now is basically a public accommodation. One other thing that I'd just like to point out, that because we only handle state government employment, it's important to remember that the Attorney General's office has an Office of Civil Rights. So if there's a private employment discrimination issue, that's who you contact for that. So I just always like to make people aware that there is that avenue as well. And I think that pretty much sums us up.
Thank you, Melissa. Now, Ted. So, Ted, you've been doing this work here in Vermont for decades. Can you tell us how has housing discrimination manifested itself in Vermont over the years, and how has the work to fight it evolved? Oh, whoops! I have to. You're still muted.
Mute. Okay, sorry. And you'll have to excuse me. I might have to get up and let my dog out here. She's scratching on the door. So let me just do that and be right back 5 seconds.
Sure. The joys of all of us working at home.
Yeah. Although I like it when we actually get to see the dogs.
Yeah, exactly.
Okay. Yeah. Oh, it's fine until she starts scratching to get back in. So, yeah. Well, Vermont is unlike quite a few states, especially some of the bigger ones, with the very large municipal entities, big cities. There's such a small percentage of minorities, people of color in this state, which is beginning to change, but especially in the early days of Vermont's fair housing law, even though all the federal categories were also included in the state, which includes race and color and national origin, etc. There wasn't that much opportunity for housing discrimination against people of color in Vermont because they just weren't here. Now, the interesting thing is Vermont Legal Aid some years back and more than once has done testing and found that racial prejudice occurred much more frequently than we would like to think in Vermont. It's a real thing here. It's just that, especially in much of the states, still there aren't that many people of color to discriminate against. If people of color feel uncomfortable about moving to a certain area, then it might help perpetuate the kind of segregation that we have, actually. But the kind of things that have occurred, much more frequently in the state is discrimination against people with disabilities. Fortunately, protection included for those people in the state as well as federal law. And Vermont includes protection for, let me just say, people with children in their family under the age of 18. That's a protected class, and there's quite a bit of discrimination in that area in the state. And so that always kind of rises to the top of the percentages of cases that come to those of us who have done or are doing work with fair housing. The issues that I worked on a lot, and I think that a lot of people are still working on a lot, have to do less with individual cases of discrimination against persons or households, which is very important to have Human Rights Commission and Vermont Legal Aid working on that, because that's a key part of enforcement of the law. But another thing that happens is the systemic issues that tend to create discriminatory systems in the state. So that prime example is the kind of zoning and development laws. Even though there is now protection against blocking development that's intended for lower income people, which is a good thing. You know, some of us worked really hard in helping get that passed. But still, there are a lot of ways that prejudice and discrimination can enter into laws. Are in some cases a lot of zoning laws that haven't changed in eons. And so essentially those kind of zoning laws have included provisions that make it harder for people of lower income to find affordable housing in towns in the state. And we also know that, as is true throughout the nation, people in various protected classes tend to be more highly represented in the lower income brackets of our socioeconomic system. So just to exclude people of moderate to low income in some areas is effectively to discriminate against people based on categories of fair housing law, including race, color, disability, national origin, etc. So that's a little bit of a wind up there. I don't know, you know, I keep waiting on, maybe there'll be some questions I can follow up on from that.
Yeah. Oh, sorry. Thanks, Ted. And Jess, I was gonna just ask Melissa to talk about what fair housing complaint looks like, but if you had a more pressing question. Okay. Melissa, can you tell us, I'm just gonna say the same thing. Can you tell us what a typical fair housing complaint looks like?
I mean, it's tough. They're all pretty unique. And, you know, sometimes they have kind of amazing facts that you never really would have, you know, written yourself. But I would say the most common cases we get are disability, especially when it comes to reasonable accommodations or modifications. And the winner there, absolutely, hands down, is emotional support animals. That's what we see the most of. There's a lot of confusion on both sides, tenants and landlords, about emotional support animals and if they have to be accepted, whether people have to pay a pet deposit. I mean, you know, all these things. So we are constantly seeing those cases. And I would say that the other most popular case, as Ted was discussing before, is people with children, having minor children. That's something that, you know, people are actually pretty comfortable just saying straight out, I don't rent to children. So people really, landlords, many of them seem to really lack that knowledge that that's not a choice you get to make. So those are the most popular that we see. But I mean, I've had a race case recently, discrimination on religion recently. So we have others pop up.
Thank you. And before we go back to Ted, I have a follow-up question for you on that.
Sure.
So what happens when someone files a fair housing complaint? Can you explain to our audience the steps?
Oh, definitely. So usually what happens is that someone will call, and John McKelvey is our case manager. And so he handles the call and kind of does this initial intake to see if the elements are there for a fair housing complaint. So we kind of have to check that first. And many times, and then we're super appreciative of, you know, the work of the CVOEO, because they will help refer clients to us in legal aid, and oftentimes they'll help individuals fill out our intake form which is, you know, tremendously helpful, because it's hard. It's hard to know what you're supposed to put on that form, what, you know, if you don't know what discrimination necessarily is. So I feel like there's a good partnership out there with that. But if there isn't someone, you know, helping, the person who calls and John thinks that there is, you know, we do have jurisdiction, he will draft a complaint going back and forth with that individual until there's something that they're comfortable with and are willing to sign off on. Once they do that, it is sent out to the respondents to file a response with us. So they basically go through and just respond to the allegations, and, you know, we'll provide evidence if they to show that that's not how it happens and things like that. Those really vary. We really appreciate when they're really thorough responses, but sometimes they're just straight denials. And then the first thing that we usually do once all that is in progress, we have a complainant, we have a respondent, they're all aware, is that we try and see if we can settle the case. HUD actually requires, we have a HUD grant, and they require us to try and settle the case throughout, see if there's a way we can work it out. Obviously, people aren't forced to take a settlement, but that's the first thing that we do. If that doesn't work, we start our investigation, and so we'll ask both parties, either specifically or generally, what documents or evidence do you have to support your position? And so we try and get those first, look through them, and then we interview all witnesses that seem to have information about the case, and we'll ask the complainant and the respondent, hey, who do you think we should talk to? And then we'll, you know, see who we think we should talk to. So we do the complete investigation while trying to settle the whole time. And if we cannot reach a settlement at the end of the investigation, the investigator, staff attorney, that would be me, will write a report that ends, you know, describing exactly what happened, what the law is, laying it all out, and at the end put a recommendation whether we believe that there's reasonable grounds that discrimination occurred, or we don't believe that there are. So that's where it goes back to our commissioners who have, you know, read the reports. The complainant and respondent has an opportunity to respond to the report. And then there's a quasi-judicial hearing that is held. And what that means is that there's no presenting of evidence. The parties and their attorneys, if they have attorneys, can show up and tell the commissioners what they think is important for the commissioners to hear in order to make a determination. So after that, after the hearing, the commissioners will vote and make their recommendation. If it's no reasonable grounds, they don't believe there's reasonable grounds to believe discrimination occurred, that's it for us, the Human Rights Commission. If they do find that they believe there's reasonable grounds, then it goes to our executive director, Bor Yang, and she has 6 months to try and conciliate the case or mediate the case to see if she can resolve it. If she cannot, for housing cases in particular, most of the time, then the Human Rights Commission will file a complaint in court, and it will go through the judicial process. If for some reason we aren't going to be the ones to litigate it, the complainant would still have the option to go to court themselves and continue. And actually they have that option throughout. So people aren't required to go through this, or if they're in an investigation and decide they just want to go immediately to court, they always have that option as well. And I think that's where we reach the end of our story.
Thank you.
It's, I mean, very in-depth process. It just occurs to me how important it is for Vermont Legal Aid and the Fair Housing Project and the Human Rights Commission to work together for that reason.
Absolutely. I mean, it's so helpful to have additional people to tell us what the facts are, because sometimes it's difficult with complainants. I mean, they're often not in a great space if they're about to lose their housing, or, you know, and so any help working together that we can do to, you know, get their complaints on paper and out there is fantastic. So yeah, we appreciate all our allies out there.
Looping back to the systemic issues around fair housing, Ted, you had touched a little bit on zoning issues. I wonder if you could tell us more, what are some of the reasons for the existence of exclusionary zoning, exclusionary housing policies?
Right. Well, there's a number of factors involved, but a number of them can be summarized as a kind of not in my backyard kind of thinking on the part of people who are influencing or making policies. But there's also just a historic factor involved, especially in all the little towns. Vermont is a small state, but has a lot of towns, and there's a lot of places where even though traditionally the town might have been compact with a lot of people from a lot of different socioeconomic classes living downtown, over the years, it became more of a sort of middle class occupying housing and single family housing around the downtown, and people who are lower income and maybe working in the town, perhaps as clerks or, you know, people working in service industry, having to commute in. But that has to do with the prejudice against multifamily housing, the idea that single family housing is the ideal, and that home owner occupied housing is really the only way to go, and that should be the only kind of housing that's accepted in our town kind of attitude. And if all the housing that's available is single family and often standalone single family housing, then obviously people in lower income brackets are not going to be able to, for the most part, afford to buy any of those homes, especially since the, you know, property values may have risen over the years for the privileged few, as it were, who actually own those houses. Some of them are, you know, not necessarily wealthy people, but, you know, inherited their housing, but still the attitude is, we don't want the multifamily housing. So that's really a big factor, is rejection, tendency to try to exclude rental housing, and a tendency to try to prevent any significant density. So if you increase density in a town, density of the housing, which, you know, you go way back, traditionally that's the way in the 19th century, for instance, that a lot of towns were built, you know, with dense centers, and then you go out from there and you just run into farms scattered far and wide. But now, as I said, just to reiterate a little bit, you have people of lower incomes that are having to commute often long distances to get into towns, or in some cases cities like Burlington, South Burlington, the Chittenden County area. You have a lot of people living out in the hinterland and driving a lot of miles, expending gas and car maintenance and insurance and all that stuff that people who actually are able to live in town don't have to expand. So those are some of the factors, and there I'm sure others that are right now skipping my mind, but they'll come.
Great. Thank you, Ted. Yeah, there are really big systemic issues around how how and where housing is built, and those will continue to be issues, and especially as we go into this, recovery from the pandemic, and housing issues become even more critical now. So we're going to transition soon into our Q&A portion, but first we wanted to talk a little bit about what's going on in the rest of the country related to COVID-19 and fair housing. So Melissa, could you share a little bit about what we've been seeing?
Absolutely. Just to start off, we have not been receiving a lot of calls yet at the Vermont Human Rights Commission related to COVID. We expect they'll come, but we actually have not received many. We've heard, just stories going around that, things are happening, discrimination is happening, obviously, in Vermont. But I think people, have their basic needs to take care of first. And so I don't have a lot to report from Vermont, but, from around the country, there's a lot of sad stuff going on. One thing that I've read that has increased significantly is sexual harassment by landlords. A lot of different agencies around the country are reporting increased incidents of that, and it's, the landlord feels like people are desperate. People don't want to move. They don't know where they could move. They need their housing, and a landlord's, pressuring them to, do inappropriate sexual acts, and they feel like they have no way to fight back. So that's something that seems to be increasing, and the other part too is that tenants don't, right now, with so many people out of work, don't necessarily have the money to pay their rent, and that's another way that a landlord, can use their power to exploit their tenants. It also reports have been that transgender women and women of color are at much greater risk for this right now. Obviously, I think everyone on this call probably knows that there's been a disproportionate impact on, people of all protected classes, but communities of color, people with disabilities, and women who already were bearing the brunt of injustices in our economy prior are being hit even harder now. With the racial disparities, the CDC has found that 33% of people who've been hospitalized with COVID-19 are African American, yet only 13% of the US population is African American, and very similar for COVID deaths. It's about the same percentage, which is just disproportionate. There's thoughts, that there's bias among healthcare workers, and that could be one of the reasons causing it, is that they're just not taking African Americans' concerns as seriously as whites. They're not getting the medical procedures, and they're just getting overall less quality care. Another thing that is becoming an issue and will become more of an issue is that, nearly 10% of the US population isn't proficient in English. And that makes it really hard to get the resources that people need, because it's not being presented in an accessible way. So something I think we need to be really cognizant of moving forward when we're trying to help is make sure that we have different languages, documents, PSAs, whatever we're doing, translated into other languages so it's accessible for everyone. Another group, immigrants, that's been a really tough one. The example that comes to my mind is in South Dakota with the Smithfield Foods, which had to shut down because they had 350 employees that were infected. And the spokesman for the company said, well, living circumstances in certain cultures enabled the rapid spread of the disease. So basically they blamed the employees because they're immigrants, that must have been why this happened. when in fact it's been found out that they were concealing the infections and compelling employees to work without the proper protections. You know, and in Vermont, we have, you know, immigrant farm workers who are also susceptible. They're living, you know, they often live where they farm, and those are really tight conditions. So that also makes it easier for the coronavirus to spread. But they also have the issue that if they get fired or protest, you know, the lack of equipment, they're not only just out of job, they're out of the house. I mean, they're homeless, and they're not, you know, eligible to get the stimulus checks that others are getting. So it's a really scary situation too. And you know, it puts everyone's food supply at risk. I mean, we really need farmers right now. And just, you know, the stigma against Asian Americans we've seen, and we know that there's been politicians throwing out the term Chinese virus because, you know, the beginnings, the first, you know, serious outbreak was in China. But it's been scary across the country. I mean, Asian Americans have reported being spit on, you know, they're called racial slurs. They've been physically assaulted. And so that's something that we, you know, need to keep an eye on, because there's going to be a lot of stigma coming out around this disease, whether people had it or, you know, people think that they had it, but particularly for these protected groups where there might be already some discrimination, and they're just going to loop it in and say, oh, well, you know, you're Asian American, well, you must be carrying the disease. So that's something that the country is going to have to take seriously around fair housing and discrimination in general, I think, after this is over.
Great, thank you very much. So now let's open it up to our participants. If anyone has a question, please use the raise hand feature, which is down at the bottom of your screen. And you can raise your hand, and then we'll call on you, and you can unmute yourself and you can ask your question. You're also welcome to put a question in the chat box, and we can read it from there. So does anyone out there have questions? Well, while you're thinking about your question, we have all sorts of questions that we would like to ask of both of you. So, Corinne.
Yeah, I wonder, I'm not sure who to pose this question to, but what are the barriers to reporting, I think we're like reporting fair housing issues, but especially during the COVID-19 crisis? I guess this is more of a Melissa question, but Ted, if you have thoughts, feel free to glom on as well.
Well, I might be able to glom, but I would definitely like Melissa to start answering it.
Will do. Yeah, I think the barriers are just finding the information. I mean, there's so much information out there, but I think it's just become overwhelming. And so we're just trying to find ways to let people know that we're here and that we can, you know, we're still accepting claims, we're still investigating claims. But I think, you know, a barrier just is if you're losing your housing or you don't have enough food to eat. I mean, there's just so many immediate needs that people need to take care of to be safe. And then I think after, you know, if and when there's some stability, I imagine that we're going to have more calls. But to me, that's what the barriers, I believe the barriers to be. Ted, any?
I don't need to glom any on that.
And what about protections for people who test positive for coronavirus? What are the protections under fair housing law, and would it be covered under disability, and are there reasonable accommodations possible for folks who may be immune compromised?
Well, once again, I think this is a better question for Melissa. I don't mean to be
I feel like I'm hogging.
Throwing everything at her, but
no, I just don't want to hog. But Yeah, it's really unclear. I've seen a lot of arguments that it is covered as a disability. And I think there's arguments both ways depending on the circumstances. Because usually with a disability, short-term illness, like, the regular seasonal flu would not be considered as disability. So for this, we're kind of looking as like, what long-term effects does it have? And if it has long-term effects, then it could be a disability. Or, if it's impairing a major life activity, there's an argument there that it would be a disability. And I think that, landlords are required to make sure that they're attempting to provide the reasonable accommodations and modifications that people need. People should be asking for it, even if it's just COVID-19 related, and it's the same interactive process to see if a landlord can actually do these things. I mean, because some of the, if you have people that are exceptionally vulnerable to getting this disease, they may feel more comfortable in living in another unit by themselves. And it's the question of, well, can a landlord really do that? Are they required to do that without, collecting any rent? And the question is probably no, they wouldn't be required to do that. But maybe they could do it, and do things, work things out just so everyone feels safe. The other, part of that is that, landlords don't have to rent to people that are considered a direct threat. And so that's where like the balancing really takes place. Because, at this point, people could consider COVID-19 to be a direct threat if you have a multifamily, housing structure. And so it's just finding that line, but there has been a lot of information put out for landlords that what they could do to keep other tenants safe, even if they have someone who has tested positive. People with COVID-19 don't necessarily need to use the common rooms, but if they're just in their house, in their own apartment, and everyone's practicing good hygiene and social distancing, then that should work out. So it'll be interesting. There'll be a lot of litigation over this, I think, in the future.
There's actually an interesting situation I think really touches more on landlord-tenant law than it does fair housing law, but just by way of explaining the kind of, or creating an example of some of the things that can come up with the COVID-19 now. Somebody was talking to me about in their it's senior housing. It's not assisted living or anything. It's just, senior housing where she lives. And she said that they were having, the landlord was having exterminators coming in because of bed bug problem. But these exterminators are going, in from apartment to apartment. They had no protective gear themselves, no masks, what you think they would use anyway, just spraying that stuff around. But and she was, I said, well, I gave her all the usual references, but I said, from my experience, call the health officer. And she said, well, I did, but I'm afraid to, really prompt to really get him to do anything because of possible retaliation. And, so there will be unusual things coming up like that now that, weren't really considerations so much before.
Thanks, Ted, for adding that. And I know that we've gotten questions similar to that too when it comes to, like typical maintenance issues without taking the precautions that fall into the stay-at-home order during this time. I was also thinking, and again, this might be another Melissa question, but for folks that are immune compromised, I know that last week with Vermont tenants and Vermont Legal Aid, we talked a little bit about accommodations folks can ask for their landlords if they're immune compromised. And Melissa, I didn't know if you could add to that at all. just to kind of reiterate some of the things that we've talked about.
Yeah, well, I think that does, put you to having a disability, and that would be clearly recognized under the Fair Housing Act. And so I think the things to watch out for there is a landlord can't, evict you or remove you from the building because you are immune compromised. So those sorts of issues are going to come up. Landlords still don't have the right to ask you a bunch of questions about what your disability is. And I think there would be more of a temptation right now to do that. And that's not okay. You don't have to answer that. So, I mean, again, and there's, if they could move people to certain other units that are further away from people, and things like that, that's really just a case by case, I think, to see what can be worked out.
And Jess, I don't know if you can see, but we do have a question in the chat box.
Oh, yes. Yep. So we have a follow-up question from Aeneas Roy. So if you could unmute yourself, and please feel free to ask your question.
Hi. So I was just wondering, in regards to going along with that, like as far as social distancing, like not necessarily with landlords, but with like roommates or whatever, like, because what I've been seeing and hearing a lot lately is, the person doesn't feel that their roommate is like social distancing enough. And so like, what are the limitations? Because there's no direct orders on like, how does social distance, so I guess what is the guidance with that?
I mean, it just within, multi-family units. Is that more what the question is about?
I mean, I guess an example is like somebody I'm working with that this person feels that somebody in his household isn't social distancing correctly, quote unquote, and so he wants to evict him. I guess just, and I've heard of other stories like that happening, and so I guess just what are the boundaries, or what is the deal with that?
Well, I know that these, just from when I used to work with the Vermont Tenants Program, when the roommate questions came up, I often ended up kind of scratching my head, because the landlord-tenant law does not apply directly to roommate situations. So, if somebody is subleasing from a tenant, then my understanding is, or was, that the tenant who is supposed to be collecting the rent from the tenant subleasing could initiate an eviction. I don't know how often that would happen, or what the outcome would be, but just in terms of regular landlord, in terms of regular roommate interactions, I really wouldn't know what to say about that particular question.
I wonder, I think that, and Jess or Melissa, feel free to add to this, but I think we started to kind of talk about this last week in our conversation with Vermont tenants, like what happens if someone in the building isn't social distancing, or they make you uncomfortable. I think what it comes down to is you can only do the thing that works best for you. You can't really control other people's actions, and you also can't know for sure unless someone explicitly tells you, I'm not social distancing because I don't believe in the coronavirus, or I don't believe that, unless someone's explicitly saying that's what they're doing, you can't really know for sure how someone's acting, or why they're making the decisions that they're making. So what it does come down to is if you're worried about your own immunity issues or your own health, you really can only do the thing that's going to be best for you, and you have to just hope that everyone else is doing the same. And Melissa, I don't know if you have anything else to add to that.
No, that's really good. I mean, it's difficult, but I mean, I think like both of you are saying, I don't know that a landlord can step in and do anything about that. So yeah, it's frustrating.
And we want people to be housed in this moment. We want people to have a safe place to return to. And I think it's more, it's safer for everyone to have that than to have a different issue where people are, in the process of being evicted and afraid for their housing. We really don't want people to be experiencing that right now.
That's definitely true. Yeah.
Most definitely. Do we have any other questions from the audience? I don't see any, but if you do have a question, please put a note in the chat or raise your hand. I have a question for both of you, Melissa and Ted. So what do you think the long-term implications of COVID-19 will be for housing discrimination? What do you think we'll be seeing more of later on?
Well, I'll start just with talking about, I think that with housing in a very general sense, as well as a whole bunch of other parts of our lives, there's going to be some profound after effects that we don't really know quite how to fully anticipate now. But one of the things that's happening is that a lot of tenants, as has already been mentioned, are obviously not able to pay rent now. So in some cases, rent is accumulating. In other cases, the rent is being forgiven by the landlords, but probably that can only go on so long unless or until some funds come from public sources to be able to pay the rents that are owed, or to defer them for some indefinite period or whatever. But that, I know that now, it was in the news today, that a number of nonprofit housing developers and providers are requesting in Vermont are requesting a substantial amount of the federal money that's coming into the state to help them keep going and pay for costs that in the long run could cause them to have to shut down housing or otherwise, kind of terrible things we definitely don't want to see happen. So there's going to be a lot of things to mend, and ideally we would also find a way to use this terrible situation as a way to, in the future, make more housing available, affordable housing available to people who have been homeless or came into this homeless, or are housed in a very substandard way, etc. So, there may be just some repairs in a systemic way, as well as maybe actual physical repairs to do. But there's definitely going to be repercussions that I think that we need to be ready to, keep our eyes open and figure out how we can try to sway policymakers to do what needs to be done. And that's going to be hard, because there's going to be all kinds of people saying the same thing for whatever their purposes, their goals are. So, I guess it goes without saying it's going to be at least interesting and maybe a little frightening and other things too.
Thank you, Ted. Melissa, did you have anything else to add regarding the repercussions?
Sure. I mean, my concern is, as we know, housing is so tight in Vermont right now. We're so short on housing, and it's just the tighter it gets, if that becomes exacerbated by this, I feel like landlords are just going to be able to discriminate more and more, because they're not going to have as many people, or they're going to have so many people that want their apartments that they really, aren't going to be desperate for tenants, and can really discriminate against various protected classes more easily, and that's going to be really difficult. One policy thing I think that will have to be looked at is just the credit ratings. I don't know how that's going to be handled in the future, because right now a lot of people are not going to have great credit because they lost their jobs, they can't pay their rent, they can't pay their bills, and that also could make it really difficult to rent an apartment in the future. And so I think that's something that needs to be on everyone's mind, just that Congress or the state legislatures going to have to hopefully step in and make a special kind of asterisk for this time period if your credit isn't as good as it normally would be. So those are my thoughts right now.
Thank you.
Jess, we have 2 questions in the chat. I wonder do we have time for both of them? Did you get a chance to see them?
Oh, yes.
I'll go ahead and read the first one. So from Kira, she asks, or they ask, do you have any suggestions for how a landlord would work with tenants who are complaining about another tenant who's not honoring suggested government self-isolating, i.e. having lots of guests, no face coverings, no 6 feet distancing? That kind of adds to the question that was asked earlier. And either of you can respond to that.
I mean, I think education is the key, and that's really what landlords can do is post information on what should be done, provide disinfecting wipes for mutual areas, maybe even provide masks. But outside of that, I'm not sure.
Yeah, it's another tough question. I think that, I'm just thinking off the top of my head as we go along now, but landlords should take particular care to keep common areas clean and sanitary, and probably would be wise to post things around about what people should be doing with regard to stopping the spread of the virus in the housing that they're sharing.
Yeah, most definitely. So we have our last question from Shannon, who asks, is there anything preventing late fees or anything that can be done to change that? If not, are there any potential protections for tenants going forward who may end up owing rent they still can't afford to pay? So I'll just take a stab at this one, and we are a little bit over time, so thank you everyone for hanging with us. It has a little wrap up at the end, but I want to make sure that we get some information to Shannon. So there is a bill in the legislature now that would provide some assistance towards to help with housing costs. I'm not sure where that's at right now, but we will, when we send the follow-up information, we'll send you some information about that. And then as Ted said, the nonprofit housing providers are requesting funds that would help cover some of those costs as well. So we will find out what the status is of that potential support and get some information to you as part of the resources that we send out along the way. Okay.
Yeah, so I think this is coming to the conclusion of our webinar today. We did go a little bit over time, so I apologize for that. But great questions. We really liked engaging the Q&A at the end. I think that's one of the strongest moments of these series. And we do hope to be having more in the future, so definitely make sure you stay tuned. I want to say thank you to Ted, Fair Housing Advocate, former director of Fair Housing Project, and Melissa from the Human Rights Commission. Thank you for joining us today.
Thanks for having us.
Yes.
Yeah. In terms of follow-up information, everyone should by now be familiar with our website, because that's how most people registered. If you didn't register through our website, please shoot us an email at fhp@cvoeo.org. That way we can make sure that we can get you the resources from this webinar. We've definitely referenced a few different websites that we want to make sure that you have access to. And then we also, this is our last in our 3-part series. As I said, we do hope to be doing more in the future, but other activities that happen for Fair Housing Month is that we do have, as part of our website, a gallery of artists that includes Ted, incidentally, among other really lovely art pieces. So definitely check that out, fairhousingmonthbt.org. Oh, and CVOEO, the Fair Housing Project is on the CVOEO webpage. So that's cvoeo.org/FHP. Lots of information there about fair housing policy. As always, we encourage you, if you have issues with your tenancy, if you have questions about your lease, please give Vermont Tenants a call on our hotline. We'll be putting that in the chat as well. And, hotline number 802-864-0099. And Vermont Legal Aid. Definitely check out Vermont Legal Aid for the most up-to-date information for the COVID crisis. So they've been updating their website daily, honestly. And that's where we've been going to find our updates as well. I think that concludes our webinar for today. Thank you so much for joining us. Again, thanks Ted, thanks Melissa, and thank you for all who jumped on the call today.
Same.
Thank you, everyone.
Have a good
Bye-bye.
weekend.
Bye.